but not limited to, acne, melasma, hyperpigmentation, and skin tone imbalances. It also helps to slow down the signs of aging while offering a rejuvenated glow. Let's welcome Dr. Shakima Stoutt-Ottley.
A pleasant good afternoon, everyone. Let me see, I'm kind of tall, so maybe I'll stand on a side that most people will be able to see me. I just want to say that I'm so excited to be here. And I thank Janice so much for even inviting me. I know her journey, even at that visit with her first visit with her son, and she talked about her dream, her goals, and like Dr. Michelle here, just watching her explore all of her passions is really exciting to see as an entrepreneur, and I know she's not done yet. And so I hope that everybody who's here is encouraged by what she's able to put on even today and even in her practice. So another reason why I'm extremely excited is that beauty, self-care, healthcare, they're all connected. And there's one thing that Doc said that really kind of made a connection in my mind. You need to have a healthy relationship with your hair. She talked about having a relationship with self and how valuable that is. Having an amazing relationship with your hair is even more gratifying. So I'm just here to help you understand a little bit about your hair, and I hope that you have questions for me at the end. But I want to say that skincare is hair care, because scalp is skin, isn't it? Yes. All right. So skin is actually the largest organ of the body. It produces appendages, the ones that we adorn, your nails, your hair. The difference between your skin, your hair, and your nails is that the generative type of purposes of your hair and nail rest in the root alone. So at your cuticle, where the skin connects to your nail, underneath that is the root to your nail. So what you see, you can't change. The part you can't see, you have to take care of so that you can always have a healthy nail. The same goes for hair. What you see, you can't change. You can color it, you can cut it, you can treat it, but you cannot change it. The part that influences the growth, the health of your hair, is the root of your hair, the part that's under your skin. So because the aspect of skin, hair, and nail is so broad, I'm a dermatologist, and that's what dermatologists do. We treat, we diagnose anything that ails skin, hair, and nails. And I'm excited to be here because I'm always confused with cosmetologists, which are beauty therapists for skin, hair, and nails. So we kind of cross paths in a way where you care for and I treat. So it's important that we all have like the basic understanding because we help each other. I don't do hair care in my practice. I treat hair conditions. And so I love to hand off my clients to salons who I know and I can confidently select them and say, this person or this team will care for your hair. Okay, so one of the most, I was asked for Janice to speak about psoriasis, but I'm going to change it to something general. Let's talk about the approach to the flaky scalp. Because how are we individually going to know what is psoriasis, what is lupus, what is seborrheic dermatitis, what is dandruff? So if I come to you with a category like psoriasis, you're going to ask what psoriasis is. So let's start with the basics. Everybody would have seen or encountered dandruff, not on themselves, maybe with someone, your child, anybody in your family. You must have seen dandruff. What dandruff is the excessive production of skin cells that's happening on the scalp. That can happen on the skin too, but it happens on the scalp. Is that a rash? I wouldn't say so, per se. It's just some persons who are genetically prone to have extra skin production on their scalps. That can happen for a couple of reasons. It can happen because of dryness of the scalp. It can happen because of the complete opposite of excess oils on the scalp. It can happen because of a sensitivity to hair care products that you're using. You might be slightly allergic or sensitive to something in the brand or the product, but you're not aware of it. It can also happen from hormonal shifts in your life. So sometimes as persons go through menopause, I don't know if some of us may recognize, but sometimes your skin gets drier as you get through menopause. So you may not have been having dandruff all your life, and then something happens where your hormones are adjusted, and then you have dandruff. Now, there's another aspect of dandruff that I'm always asked about as well. When does it develop into a dermatitis or an eczema? Should you come to the dermatologist for dandruff? Any dandruff? Not really. You can trust your cosmetologist, and I hope that they are here. I know that one team is here, but at least we're live. But you can trust your cosmetologist if they understand that dandruff is a condition of over-exfoliation of the scalp. So that's one part that you have to correct. The second part that you have to correct is the fact that there are oil glands. Everywhere on our body where a hair follicle comes out, there's an oil gland attached to that. That's normal, and we need it for our natural moisturizing factors. We need that for our hair lubrication as well. The issue is with dandruff is that once those oil glands are productive on the scalp, they cause those dead cells that are shedding from the scalp to build up and clump up. And so when you wear your black outfit, what you're seeing is the clumps of dead skin falling on your shoulders, okay? But that is not something that you have to be extremely concerned about. There are great over-the-counter products that can be used to help with supporting the basic dandruff. So I love Head & Shoulders Clinical because it has a little medication in it called cyclopyrox. It has great value. You must have heard of sulfur 8s. There's a sulfur 8 line. You have the grease, you have the shampoo, you have the conditioner. That's also a good line because sulfur helps to balance the pH and inflammation on the scalp. All right, and there are others that you can find out there. So as a stylist, so you go to your salon, you have dandruff. If you have a stylist that is really keen in identifying these challenges on your scalp, they can offer you a shampoo that's slightly medicated. They can say, hey, I'm gonna shampoo your hair with what I want, which is something floral, I like the smell, this is what it's gonna do, but I'm gonna give you a scalp shampoo. That's one of the most important parts to know about the shampoos that you're selecting over the counter for dandruff. It is for scalp, it's not for hair. So what you'll notice is that persons who may use a lot of those dandruff shampoos, they come to the hairdresser and say, my hair's just falling off, it's breaking, it's brittle, because those shampoos are going to strip the cuticle of your hair. But the goal of the shampoo was really just to treat your scalp. Alright? So, what is the aspect of dandruff where I come in? That is the part where you see inflammation. So signs of inflammation include redness, darkness, that means excessive pigment, loss of pigment, if you have pus bumps, if there's an unusual amount of itching, if there's pain. So these are signs of inflammation. So that means your dandruff has now entered another category called seborrheic dermatitis. The word dermatitis, we use it a lot around, and dermatitis just means inflammation of the skin. But the word seborrhea, sebum, remember I told you that each hair follicle has an oil gland. That's where the word seborrhea comes from. So that person is producing a lot of oil, plus they have dandruff type issues. There's a lot of clumping of those dead cells, and the challenge is, while we have a normal flora, let me pause for a minute to explain what normal flora is. We all have good organisms living on our skin, in our hair, on our bodies. We need them to create balance. So we have good yeast, we have good bacteria. It helps with the physiology of how our skin functions. The challenge is, those persons who develop seborrheic dermatitis, there's an imbalance. So there's an overgrowth of the yeast fungus type aspect of that normal flora. The challenge then is some persons become allergic allergic to whatever the yeast is producing. So it's not contagious because the yeast wasn't an infection in the first place. It's just that whatever is being produced by that yeast and the overproduction of that yeast is causing inflammation. That's where I come in. I usually say, if you're at a stylist, and I hope that stylists are hearing, and you notice any of those signs of inflammation, you can go ahead and do the first step that I mentioned, which is to use one of those over-the-counter medicated shampoos to get your client some comfort. But you make sure you tell them, you say, listen, I'm seeing other changes I'm not comfortable with. Can you get this checked out? The reason why I would say getting it checked out is extremely important is because this is the point that the stylist is limited at. Stylists are only equipped to take care of two conditions in the chair: dandruff and mild seborrheic dermatitis. The challenge is you cannot tell when a seborrheic dermatitis person comes in and it's really bad. You see it walking down on their face, you can see it in the back, you notice they have locks, but in all the parts are the white. And you see their hairline, you can trace it. These are changes that you cannot correct from your chair alone. Yes, the hair care aspect is to be maintained, but there's a medical aspect that needs to partner so that that person can get to their best health. The other part that's really important with lowering your thresholds to refer is that you can't tell the difference between seborrheic dermatitis and psoriasis, because psoriasis has some characteristics that overlap. And the consequences of not forwarding your clients over to getting some care is that psoriasis is a systemic condition. It is not something of the hair alone. You can have nail changes with psoriasis, your joints can deteriorate with psoriasis, you have organ damage or organ challenges with psoriasis, it predisposes you to diabetes, cardiovascular disease. So this is why if you have to even mention the word psoriasis to your client, hey, I think you have psoriasis, say in the same sentence, you need to see a doctor. Because that person will thank you and they will return to you over and over because they understand that you care about their general health and not just the style or not just the hair care aspect. All right? So I just wanted to start off our dermatitis, seborrheic dermatitis, dandruff talk by stimulating you into understanding what role some of us play as cosmetologists and some of us play as medical professionals, and we partner with it together. I hope that by me introducing you to these topics that you've generated some thought, some questions, and I'm happy to answer you today.
Just a little longer. Alrighty. Do we have any questions? I'm sure somebody maybe has a question. Nobody has any questions? Nobody have any queries? I mean, my speakers are doing a great job.
Yes.
They're doing a great job. Oh, there's one right here.
No, I said she explained everything already.
Oh, I'm sorry. Do you want to say them more?
What about people having oily skin? Is that a condition?
Yes, actually, yes, that is a condition. You can have oily skin that is medically correct, that needs medical correction. It's called seborrhea. It's not as common though, because usually you're not like generally oily. You would say there's an area that you're more concerned of. My chest is oily, my face is oily, my back is oily, and then we have different solutions to give you pertaining to that area that you're concerned about. If we have to correct then the oiliness overall, then that's a different discussion, and yes, there are systemic or tablets, medications that we can offer to help slow down the oil production. But yes, it is a condition, it's called seborrhea.
Thank you.
Alrighty, I have a question. If there is a customer who comes to my salon or the other salon and they have, for example, locks, and then we realize that let's just say we're not familiar with the terminology, psoriasis and everything else, and we realize that they have dandruff. or they start is very itchy, and with the locks it's very difficult to get it out. I know that the correct step is to, of course, refer them to a dermatologist. But do you think it's something that can be fixed, cured, aided? Because that's some of the things that we do at the salon, yes, but some of the customers are not confident in going to a dermatologist. They feel like, oh, they're just going to give me medication, yeah. So kind of give us a little insight on how important, again, it is in that case, if anybody's suffering with anything like this, or they know of anyone that they can.
So, in terms of having locks and having, whether it be seborrheic dermatitis or psoriasis, I would say that at the stylist level, at the cosmetologist level, there are things that you can do to help your client feel better or see improvement. And one of those things is detoxing. So once you've done a detox process, that helps to kind of resolve some of the excessive organisms that are going into the lock. Because locking is, you're retaining all the follicles. That means you're going to retain soiled follicles. You're going to retain some of the organisms that you cannot really cleanse out. And so while someone who doesn't have locks can wash their hair, reduce the amount of overgrowth of organisms easier, the person with locks, it kind of just falls down to the tip of the lock. And it feels like this issue is just ongoing, is not improving. So if you can encourage the lock persons to get regular detox, that's one. Two, dress their locks more frequently, because the longer you keep these protective styles, the more you have the organisms growing. They're gonna love the environment of warmth, sweating. They're gonna love that environment of oil. It's like they're feeding, all right? So you'll have to definitely dress your locks or clean your locks more frequently. So instead of once a month, it would have to be once a week.
Oh, wow.
So if they want to say, man, I don't want to go to the dermatologist, or in my case, I'll own my challenges. I cannot get into this dermatologist, it's busy.
We know all that.
Oh my God. You can actually help them by encouraging them to come and do cleansing more frequently, and of course start one of those medicated shampoos. But of course each time continue to encourage them, because they need at least one visit to make sure that this is not psoriasis, lupus, thyroid dysfunction. They need at least one visit of clarity to make sure that it is okay to continue on this way. You can deal with your dusty locks, that's perfectly fine, but at least you can rest assured I don't have any internal issues that's causing this scalp problem.
So, do you think that's the reason why locks grow so crazy? Long. Quick.
No. What do you mean locks go so crazy? I mean,
It grows long. Yeah.
Oh, no. That has nothing to do with it. Your pace of growth for your hair depends on genetics. It has nothing to do with what type of style you wear. It's just the genetics of that individual you might be watching. Their locks will grow longer because they naturally have a faster pace of hair.
To piggyback on what she's asking with the growth of the locks, I've known guys that try to grow their hair, braiding it, for years. It would not get any longer. The moment they went locks,
well, let's go back to what lock is doing. Lock is retaining your old follicles. So your length that you would have put that lock in, once you shed that hair follicle, you see that root bud, you still get to take advantage of the length of that hair follicle that you've shed. So it creates more integrity to your locks. So that person gets longer locks. It looks faster, but it's just that they are using up the same follicles. They don't have any wastage like us. We would have more shedding, you throw it in the garbage. There's no wastage with locks.
I have a slightly off-topic question, but can you talk to us a little bit more about alopecia and maybe how we recognize it, what types we have, that sort of thing?
Absolutely. So I'm going to talk about the alopecia that we cause ourselves first.